Alright guys, so if you're suffering with neck pain and you've watched our previous videos, you are now going to understand that the importance of a good neck curve and good posture is paramount to good health within the spine and the tissue. When we lose that neck curve, it creates all sorts of problems. So, quick postural check you can do in the mirror. When you look at yourself in the mirror, your ear should meet your shoulder, you should have a nice curve in your spine. However, when we have that corporate lifestyle, we're strapped to our desk, we're commuting in a car, we have a trauma like a car accident, what happens is we lose that neck curve. So essentially the shoulder shifts forwards. Well, what that does is puts massive amount of stress and tension into the soft tissue. If you use this elastic band analogy, that's good posture, that's poor posture. So when you function around a tissue that's doing this consistently, that poor load, that stress and tension breaks that tissue down. As you breaks it down, it forms something called adhesion. We all know it as scar tissue. It's tissue, but it's not as strong, it's not as elastic, it's weaker, and over time it becomes more prone to problems. Limits our range of motion, and it certainly will cause neck pain or poor function in life. So we need to address that adhesion within the soft tissue when we're addressing neck pain, because if we miss it, then essentially that tissue is never going to be restored to normal function, and you're just going to go through that negative circle of chronic, consistent neck pain. So how do we address it? Well, first of all, we need to address the curve in your spine. That's due to digital x-rays, state-of-the-art digital x-rays, and then we're going to do some range of motion testing. We're going to test for the range of motion, the structure, the stability, and the function of that tissue. When we find those joints and the tissue that are compromised through poor range of motion, we need to address it through treatment. So we're going to walk through that now. So we obviously would have evaluated Amber and her spine via x-ray, orthopedic exam, some specific range of motion tests. But essentially following that adhesion, when you palpate the tissue, it should feel nice and spongy within here. However, when you find something that feels like a trigger point, that sore, taut, tender tissue, that's adhesion. So all we're going to do, we're going to load that tissue, come off a little bit, the strap. And you're going to take the tissue that crosses that joint through range of motion. Okay, and you're going to contact the same tissue, and you're going to do 5 or 6 passes on that tissue. What that does is it takes the tissue while under tension through range of motion, and that breaks down that collagen, that adhesion within the tissue. By repetitively doing that, combining it with chiropractic care and physical therapy to improve your alignment and improve your stability, that's how we can get your neck pain corrected short, effectively, and long term. If you're suffering with poor range of motion, chronic pain in your neck, or you know anybody that does, please tag share in this video, and we'll see you on the next one.